Why is diagnosing unspecified bipolar disorder so costly? Diagnosing unspecified bipolar disorder can be surprisingly expensive, and many factors contribute to this high cost. This type of bipolar disorder is used when someone shows significant symptoms but doesn't fit neatly into bipolar I, bipolar Roman II, or cyclothymia categories. Because of this, the process of diagnosis becomes more complicated and resource-intensive. One major reason for the high cost is the difficulty in accurately diagnosing bipolar disorder. Symptoms often overlap with other mental health conditions like major depressive disorder or anxiety disorders. This overlap makes it hard for clinicians to tell exactly what is going on. To get an accurate picture, healthcare providers usually need to conduct detailed clinical interviews, review medical histories, and sometimes perform physical exams or lab tests to rule out other causes. These steps are essential but add to the overall expense. Since unspecified bipolar disorder doesn't meet the full criteria for other bipolar types, clinicians must carefully differentiate it from similar conditions. This often means multiple appointments, consultations with specialists, and sometimes second opinions. All these steps increase healthcare utilization and costs. People with bipolar disorder, including the unspecified type, often have other health issues too. These comorbidities like anxiety, substance use, or chronic physical illnesses can make diagnosis and treatment more complex. They lead to more visits to doctors, hospital stays, and emergency room visits. Each additional service adds to the total cost of care. Research shows that when bipolar disorder is complicated by other conditions, healthcare costs go up even more. For example, if someone is initially diagnosed with depression but later found to have bipolar disorder, they tend to have more hospitalizations and emergency visits. This is because unclear diagnoses and gaps in ongoing care often lead to higher expenses. These patterns are especially common in unspecified bipolar disorder, where the diagnosis can remain uncertain for longer periods. Once a diagnosis is made, treatment costs also add up. Managing unspecified bipolar disorder usually involves medications like mood stabilizers and antipsychotics, which can vary in price. Generic drugs tend to be cheaper, but newer or brand-name medications can be quite costly. Patients often need to try several medications before finding the right one, which increases expenses. In addition to medication, many people need regular therapy sessions, whether individual counseling or group therapy. For severe cases, inpatient or residential treatment might be necessary, which can cost over $1,000 per day depending on the facility. Even outpatient therapy can cost around $1,500 a month, and these costs continue as long as treatment is needed. Because bipolar disorder is often a lifelong condition, ongoing management adds to the total costs over time. Regular checkups, medication adjustments, and monitoring for side effects or signs of relapse all requiring resources and money. There are also indirect costs to consider. These include lost work productivity, absenteeism, and sometimes interactions with the criminal justice system. While these are not part of the direct medical costs, they show how much the disorder can impact society economically. Accurate and early diagnosis can help reduce some of these costs by improving treatment and stability. For patients and healthcare providers, understanding these costs highlights the importance of seeking care from experienced professionals. Proper diagnosis can prevent unnecessary tests and treatments, saving money in the long run. Improving diagnostic accuracy and ensuring continuous care can also help reduce hospitalizations and emergency visits, which are very costly. In summary, diagnosing unspecified bipolar disorder is costly because of the complexity involved in distinguishing it from other conditions, the high rate of additional health issues, frequent healthcare use, and the need for ongoing medication and therapy. These factors create a significant financial burden for individuals and healthcare systems alike. But these costs reflected the challenges of managing a condition that is often hard to diagnose and treat properly. It underscores the importance of personalized, evidence-based care guided by established medical standards. Always remember to consult healthcare professionals for individual diagnosis and treatment options.